Hello, everybody, and welcome to O2 Classroom. I'm Lisa, and I'm the educational content developer here at First Class Medical, and also the producer of O2 Classroom. Today, we have a topic that was suggested by one of our viewers. It's somebody that was diagnosed with what is known as, it's more commonly known as LAM. LAM stands for Lymphangioleiomyomatosis. Lymphangioleiomyomatosis. It's so hard to say. So I just call it LAM. Lymphangioleiomyomatosis. And what that is it's kind of a rare disease. It generally strikes women of childbearing age. Very, very, very rarely happens with women before puberty or postmenopausal. So they don't know yet exactly what the cause is. It's kind of a rare disorder, and I think that's why is very understandable as I started to look into doing this show. It's not that easy to find information about it. So I was excited to learn more about it. And I hope that this leads to more information being out there. I've noticed a lot of times when we do shows like this, we do have a lot of viewers, and sometimes that will spur other, there are a lot of people are bloggers, a lot of people are, healthcare professionals, and it'll sort of encourage them to, look into something further or put more information out there, something they feel like we didn't cover or whatever. So I hope that happens with this, because there was not a whole lot of information out there. Unlike COPD or some of the other conditions that we discussed, there really are no risk factors involved. It doesn't come from smoking. It doesn't come from, environmental exposure to chemicals or fumes or things like that. Just sort of happens. And like I said, even though it happens generally to women in childbearing years, they don't think hormones are necessarily cause of it. It just happens that when a woman hits a certain hormonal level, sometimes what's already dormant in there genetically can be released or begun. So what is LAM? It's a result of abnormal growth or of smooth muscle cells. The signs of LAM in the body, including thickening around the areas of blood vessels, as well as breathing tubes or bronchioles that we talk about, and that's why it's considered a respiratory disease as well. So when you have COPD or something where you have chronic inflammation, that inflammation sort of increases and recedes depending on, a lot of things, triggers and just, other things. But in LAM, that tissue gets thickened. The texture of it gets thicker, the width of it just gets thicker, and it stays permanent like that. So it's a progressive disease in that way. It can also impede lymph channels. Your lymph system is sort of a drainage system that it helps your body maintain fluid balance, and it also helps your body kind of move white cells throughout your body to fight infection, fight diseases, and things like that, sicknesses. So it can impede those things. So with the blood vessels, it can be, it hurts circulatory system. When it thickens your bronchioles, obviously it affects your breathing. And when it impedes that lymph system, it can cause other illnesses because your body isn't as able to fight with those white blood cells as it normally would be. LAM in itself is not contagious, but it's often associated with what is called TSC, or tuberous sclerosis complex. It's an inherited disorder. So even though maybe one of your parents or grandparents didn't actually have it, they're passing down a gene that might cause you to have it. Tuberous sclerosis complex, it's a hereditary condition also. You'll notice like changes in skin, and it also affects your brain, kidney, and heart. Seizures are also a frequent complication if you have TSC, and some people have experienced growing up learning disabilities when they have TSC. But mostly you'll notice changes in the skin, like thickening of the skin and things like that. But those people who have TSC often also have LAM because you're more prone, you have a genetic, disposition to that thickening of tissues and cells and things like that, your muscle cells and things. So the symptoms of LAM are going to sound familiar to anybody who has COPD or any sort of other chronic illness. Shortness of breath, chest pains, aches, frequent coughing and wheezing, things like that. But with LAM, there are a few other things that are, obviously more serious that sometimes do happen with COPD or some other, IPF, but it's more extreme cases. But people with LAM can often experience pneumothorax, which is more commonly known as a collapsed lung. The reason it happens is because when you have LAM, sometimes you have cysts in your lungs, and as those cysts rupture, they release fluid, and they release air and things like that into the lining of your lung, which causes it to collapse. So your lung has to be reinflated in that way. And it can also cause pleural effusions. That causes bodily fluids to collect in between the space of your lung and the chest wall. So fluid gets in there. So it starts pressing down in your lungs, and that pressure makes it hard to breathe. You might also experience blood in your urine. That's mostly because if it affects your kidneys, sometimes you can get benign tumors that form in your kidneys, and sometimes they bleed, and then that blood will leak into your urine. You also might experience enlarged lymph nodes. Lymph nodes are generally in your neck and under your arms. Sometimes you go to the doctor and you have a fever, you'll notice that they'll feel there to see, what's collecting there, because that's how your body, that lymph system, that's how your body fights that illness. So sometimes those nodes will get bigger, and sometimes you'll have abdominal swelling that's often associated with pain, and other bodily swelling, such as the edema, like the fluid we've talked about collecting in your feet and ankles, things like that. So if you have a collapsed lung, what are the symptoms of a collapsed lung? How would you know? You'd have severe chest pain on one side, especially when you try to inhale or take a breath. You'll have severe chest pain. Extreme coughing, your breathing and your heart rate will go way up. If you're experiencing greater fatigue than normal or in shortness of breath, or if you have cyanosis, and cyanosis is when your fingertips or lips have a cyan or blue color because your oxygen saturation has gone way down. Anytime, whether you have LAM or not, if you have a symptom like that where your fingertips have turned blue or your lips have turned blue, it's time to go right to the doctor. Don't get on Facebook and ask any questions. Just go right to the doctor. So what causes LAM? Like we said, it's genetic, but it's caused by the abnormal growth of smooth muscle cells in the lungs. The triggers for this process aren't well understood at this point. However, hormone replacement therapy can aggravate the process. So, if you're going to, ladies who are trying to get pregnant and they go through some hormone replacement therapy or something like that, or ladies who are, trying to battle symptoms of menopause, hot flashes and headaches and mood swings and things like that, it can trigger the process. The risk factors, like we said, aren't known. We think it's genetic mutation. So how is LAM diagnosed? How is it differentiated between other lung conditions? So your provider will order a CT scan of your lungs, and they'll try to identify those cysts. Those cysts that I said will sometimes collapse a lung as they burst. So they'll try to identify if you have any cysts in there. You also probably have to go through an ultrasound to determine the presence of other tumors or other growths that are happening in your lungs. And you also probably have a lung function test, like a fitness test, like we've talked about with COPD, where you'll, walk on a treadmill or just walk up and down the corridor for 6 minutes, and they'll, put a pulse ox on your finger to just see how your oxygen saturation goes up and down, how out of breath you get. And they'll try to measure your breathlessness for, are you a little bit out of breath? Are you so out of breath that you can't talk? Are you just so out of breath that you can barely breathe? You're really gasping for breath. They'll measure it like that. Sometimes if, they've noticed some abnormalities in your CT scan or your ultrasound, they often might give you an open lung biopsy. And the doctor will basically, biopsy a section of your lung. They'll cut out a portion of your lung so that they can look at it under a microscope to see if those cells are present. They also might give you what is known as a bronchoscopy, which is they have a camera on the end of a tube they'll stick down into your lungs through your nose or mouth, and they'll go all the way down there, and they can use that camera to look around in there. It's pretty interesting technology. How LAM affects your lungs. So as we said, that abnormal cell growth will cause thickening of the cells of your bronchioles or air tubes. So when those blood cells, when those alveoli can't, you lose some of your lung elasticity and you can't do the gas exchange effectively because the walls have thickened. and things like that. And also with LAM, it also affects the capillaries in your blood vessels. So when those blood cells are blocking your airways, it's going to cause difficulty in breathing, shortness of breath, low oxygen levels, some of the things we've talked about before. And as we said, if there's cysts in your lungs and they rupture, they allow air to leak from your lung into the chest cavity, which causes a problem. And that is what causes sometimes the pneumothorax or the collapsed lung. So how do they treat LAM? Currently, there's no treatment to stop the growth of the cysts that occur in LAM, unfortunately. So most treatments are basically to ease the symptoms of LAM. And as you know, like on this show, we try to be very positive and solutions-based. So we're going to talk about some dietary things. None of these things are cure for LAM, but they're just some things that can help you with just basic overall health and lung health, and help your breathing become a little bit better, no matter which condition you have. So in order to treat the symptoms of LAM, some of the things that they use are possibly oxygen therapy, and that's where we come in. You know, we're the largest supplier of oxygen concentrators. So your doctor may find in your pulmonary fit test that your saturation levels are down, you know, in a dangerous level. Anything above 90 is considered normal. Anything below 88%, if you're consistently under 88% saturated, your doctor's likely to consider supplemental oxygen therapy for you, depending on, you know, other things that they can do. But so oxygen therapy is a very common treatment for LAM. Also lung rehabilitation, breathing exercises, pulmonary rehab, things like that. They often remove air or fluid from the lungs or the abdomen to help you breathe better. We'll talk a little bit about that later. And they also watch for treatment of weak bones, osteoporosis, which is very common with lung patients. In this case, it has to do with your lymph system as well as some of the medications that you have to use. They often will recommend that you get your standard vaccinations to prevent lung infections, flu, COVID, pneumonia, you know, whooping cough, standard vaccinations for that. And there are inhaled medications that you can use. We'll go over some particulars in here in a minute. That will help you improve your breathing. In some extreme cases, they might consider a lung transplant, but they generally try these other things first. Okay, so for the treatment courses, first of all, there's going to be lifestyle changes. No, you're going to have to quit smoking tobacco, sleep for 7 to 9 hours a night, and get your vaccines, as we talked about. There are some clinical trials that, you know, often go on. We did a whole show on clinical trials several months ago. I'm sure we'll cover it again because it often gets asked about, especially stem cells. But if you're considering a clinical trial, please go back and watch that show because it sort of explains how a clinical trial works, how to get in, but also how to make sure that you're in sort of a legitimate study, and how to make sure they're accredited with the FDA and all that stuff. So if you're considering something like that, go back and watch that show. If you want to watch that show or any of the other ones, go to First Class Medical's Facebook page. Up at the top, you'll see a drop-down menu that says More. Click on More, go to Videos, and you'll see any number of topics in there. Generally, you see myself or Corey Lechner, who is one of the owners here, you know, talking about any number of topics regarding managing lung conditions. So clinical trials is something you might consider. There's a lot of studies going on right now. One of the medications that have been approved for LAM so far is called rapamycin. Rapamycin, it's the first medicine to be tested as a treatment for slowing and stopping the growth of cells, not just mitigating symptoms. This medicine was originally developed to prevent the immune system from rejecting kidney transplants, but studies have shown that rapamycin helps regulate the abnormal growth and movement of LAM cells. That was from National Jewish, that statement right there. And again, like I said, oxygen therapy. If your blood oxygen is low, they'll subject you to a 6-minute fit test. They'll, you know, analyze it from there if you need oxygen therapy. Fluid removal from chest. There's a few different procedures that, you know, can help prevent air or fluid from building up again. So to remove fluid from your chest or abdomen, to sort of help relieve that discomfort, the doctor will use a needle and a syringe. I know that doesn't sound pleasant, but your give you some painkillers. But if the large amount of fluid builds up in your chest, the doctor may have to insert a tube, which is harder. So they'll try to do it with a needle first, just, extracting slowly that fluid from your chest cavity to help relieve some of that pressure there. If it doesn't, it can relieve shortness of breath, and which has been caused by your collapsed lung. And your doctor can usually remove the air with a tube. They insert the tube between your side ribs, and the tube's often attached to a suction device. It'll sort of, suck that out. If those things don't work, then you might need surgery, which is, if they do that, they'd probably do it at your hospital bed, things like that. But if those things don't work, then you're probably going to have to go in and have surgery. Another thing that they've looked at is hormone therapy. Estrogen's thought to play a role in LAM, as I said. They're judging that by the age range from which LAM presents itself. So the doctor may want to treat you with hormone therapy, which limits the effects of estrogen on your body. So hormone therapy can be a shot, or it can be pills, things like that. And some doctors may suggest surgery to remove the ovaries in extreme cases. This causes menopause, an early onset of menopause for some, and reduces estrogen levels in the body. Unfortunately, there's no evidence at this time if this treatment is 100% effective or not. It's just something that they're still studying. It's going through clinical trials. So living with LAM, like we said, we try to, offer some solutions and try to offer some, things that you can do to help yourself if you're living with this disease. So one of the things is eating well. And when researching some of the dietary things for this, one of the things I noticed that a lot of the dietary things that we suggest for COPD and IPF and lung health and things like that are pretty much exact opposite for LAM. So I thought that was interesting. So we're going to go through a few specifics here in a minute. But basically, for anybody, just eating, healthy, balanced food, lots of vegetables, lots of fruit, lean protein, and calcium-rich foods are good. Limit sugars and fats in this. So when we talk about COPD and we talk about, creating CO2 and eating, we talk about eating healthy fats. But in this particular diet for LAM, I'm going to go through a list here from a doctor, actually not a doctor, but a licensed dietitian who was doing a presentation for a lung transplant team at Loyola University. So I'm going to go through that here in a minute. But she suggested mostly fat-free, completely fat-free foods. So I'll go through a list here in a minute. So exercise is important to maintain healthy blood pressure, healthy cholesterol levels, insulin levels, decrease anxiety, which, we've talked about affects your breathing. Also decreases depression and, keeps body fat at a healthy weight, improves your strength, stamina, balance, coordination, bone health, and self-esteem. So if you don't regularly exercise, talk to your doctor, and they might recommend a exercise plan for you. Keep in mind that breathing is largely a muscular function, so you want to do things to keep your muscle tone intact. And a lot of people who have complained of loss of quality of life because of COPD or other respiratory conditions, it's because of loss of mobility. Yes, some of it's about breathing, but a lot of it is about loss of mobility. And that's because if you get underweight, your body will start eating away that muscle. It's called muscle wasting. And it really affects your mobility and your ability to literally do anything. So keep that in mind. Exercise and breathing retraining. So we've talked a lot on this show, and it's probably time for us to do another show about this. We try to do it every 6 months or so because it's an important skill for anybody living with a respiratory condition. Training yourself to breathe. It's hard there's nothing that's more of a reflexive action than breathing. But it's something you have to learn how to concentrate on, and things that you maybe do as second nature, you have to relearn and retrain yourself. And like I said, it's hard to do something that you're just sort of doing as a reflex. I don't know if if you've been driving for a while and then you're trying to teach somebody how to drive, it's very hard to explain what you're doing when you're, turning or things. It's just something you do so often that you're just sort of doing it, as a matter of muscle memory and reflex. So to try to explain to somebody how to, when you're turning, to slow down, but not too much, because you got to have some, momentum as you're going. And, to turn smooth, you got to have some, motion while you're going. And it's just hard to explain, what you're doing with your feet, what you're doing with your brake and gas when you're trying to turn the wheel and things like that. Breathing exactly the same way. You're going to have to learn just how to think about it in the same way. And one of the things that they recommend for LAM patients is stuff we've talked about here all the time, pursed lip breathing, because that helps with, calming down those airways. It also helps getting the CO2 out so you can get more oxygen in. And also can help with emotions, can slow anxiety down and just slows your breathing down so that you're breathing more fully. You're not just breathing into your chest, but all the way down into your lungs, where that's going to do you some good. So pursed lip breathing, and also, diaphragmatic breathing, deep breathing. And they don't so much do huff coughing in LAM because they don't have as much, mucus accumulation or production as you would like in COPD. But they try to do those breathing exercises to keep those muscles supple and to, relax your airways. And also they do a thing that is called, they're calling at the National Jewish website, coordinated breathing. And that is basically trying to concentrate on breathing so that you're not holding your breath. A lot of times when you're going to do something that's going to, you feel like it's gonna be an exertion for you, it's kind of natural to sort of hold your breath a little bit, and then you exert yourself, and then you just make yourself more out of breath. I've used the example before of I had a knee injury quite a while ago that never really fully healed. I didn't probably physically rehab it like I should have, but a lot of times when I go upstairs, my knee hurts. And I noticed, sometimes like I would be, getting out of breath going upstairs, and it's like, okay, well, probably, I need to lose weight and, get in better cardio shape. Those things are true. But I also noticed that when I step with that foot, I'm kind of thinking my knee's going to hurt. So I'm bracing myself and I'm holding my breath a little bit, and that's making me more out of breath. It doesn't help my knee at all. So, it's coordinated breathing is like, if you're going to lift something, before you lift it, breathe in, and then when you lift, breathe out while you're doing the exertion part. Same thing with stairs. Breathe in, breathe out when you're stepping up, stepping up, and just try to coordinate your breath like that. Same thing with eating. If you find yourself out of breath when you're eating, a lot of times COPD patients will hold their breath when they, unconsciously when they're about to take a bite because they don't want to cough. But that also makes you out of breath, and then it's hard to breathe also when you're chewing because you don't want to, breathe something in and, choke yourself. So, make sure you're breathing, you're taking, and if you took a bite that you can't breathe through or inhale through, it's too big of a bite. So, take a smaller bite, and that should help you out. So breathing retraining is something that is essential, not only with LAM, but with all kinds of, other respiratory conditions, which, like I said, we'll talk about. And then managing your emotional health, as with any chronic condition, is important. It's, your mental, emotional, and physical health are inextricably linked. Several studies have shown that. So, do what you feel like you need to do. If you feel like you need to talk to a trusted friend, if you don't feel comfortable talking to somebody about your health, you could talk to a pastor. You could ask your doctor for a recommendation for maybe a therapist, a counselor who specializes in helping people with chronic conditions, might be helpful. Okay, Michelle. Michelle's telling us she's here. Hi, Michelle. Michelle runs a great support group for COPD patients. She also does everything she can to, come to this talk every week to learn all she can and then pass it on to her members in our support group. First Class Medical also has a support group, which has over 5,000 members now. Some of them are healthcare professionals, but a lot of them are people just like yourself who are living every day with a respiratory condition. I'll put the link here, so, join if you can. So this is the list of foods that was created by Rachel Dunn. She's a dietitian that was doing a presentation at the Loyola Transplant Center. And like I said, she's recommending a lot of fat-free foods. So she kind of, divided these into categories. So for fruits, things that are allowed, just mostly fresh, frozen, dried fruit juices, things like that are all allowed. Same with vegetables, any kind of, plain, fresh, frozen, or canned vegetables, or tomato juice, fat-free tomato sauce, and fat-free paste, if you're going to use those. Pickles are allowed. Some things that she suggested you avoid. Now, this is one of the things that, some of the things on here are fats. They're healthy fats. So we've recommended them a lot for COPD patients and things like that because of the respiratory quotient, how fats create the least amount of CO2 for the most amount of energy that you're given and slowest burning amount of energy that your body can use, which is measured in calories. But like I said, this diet is mostly suggested fat-free. So some of the things she suggested you avoid are avocados, olives, and coconuts, and and vegetables in butter, oil, cream sauce, or cheese sauce, and any kind of fried vegetables she suggests you avoid. So she suggested avoiding olives. I'm assuming that also means olive oil, which we've suggested a lot, is a healthy fat, good for anti-inflammatory things as well. For breads and cereals, she suggests fat-free bread and crackers and cold cereals without nuts. We've suggested nuts a lot for, omega-3s and things and healthy fats, but no cereal, no nuts if you have lamb. Fat-free rice cakes, fat-free bagels, fat-free pasta to go with your fat-free pasta sauce, and rice, fat-free air-popped popcorn, and potatoes, yams, and fat-free muffins as well. She suggests that you avoid breads or cereals with fat and or nuts in them, breads with cereals or cereals with butter or, covered with butter or anything like that, and also avoid microwave popcorn. For meats and, proteins, she suggested fat-free lunch meats and fat-free hot dogs are acceptable. Shrimp, scallops, coated with, spray oil, egg substitutes or egg whites are okay. Fat-free veggie burgers and fat-free beans. Legumes are good for this condition. They're good for your lungs. The fat-free varieties of black beans, pinto beans, kidney beans, white garbanzo, lentils, lima, and refried beans are all good. She suggests avoiding whole eggs and other meats, fish, nuts, seeds, peanut butter, or other nut butters. Also avoiding soybeans and edamame. And I feel like that is largely related to the hormone estrogen factors of this disease. Fat-free dairy is good. Fat-free milk, cheese, sour cream, cream cheese, cottage cheese, yogurt, and fat-free ice cream are okay. She suggested in the morning maybe some fat-free Carnation instant breakfast mix with water or with skim milk. But she wants you to avoid even low-fat, but also full-fat dairy products or fat-containing creamers. A lot of the beverages she suggests: fruit juices, nectars, fat-free fruit beverages, lemonade, and soft drinks and sport drinks are okay in moderation. Also, tea and coffee is fine. She cautioned you to avoid beverages made with low-fat or full-fat dairy products. Desserts that are acceptable: gelatin, angel food cake, hard mints or things like that, if you need them for your throat, are okay. Jelly or gummy candy is okay. Licorice, fat-free frozen juice bars, fat-free popsicles or sorbet or Italian ices, and also fat-free animal crackers or fat-free cookies. But avoid cookies or things like donuts, pies, cakes that have fat in them, full-fat butter or things like that. Avoid brownies and regular fat ice cream. And for condiments, fat-free mayonnaise, fat-free salad dressing, fat-free creamers, and fat-free whipped cream are okay. Avoid butter, cream, margarine, lard, vegetable oils, and low-fat or regular mayonnaise. So I learned a lot about LAM in doing this presentation. If you know anything more about that condition, or if you've been studying it, or you know a good source, post it here in the comments so we can pass it on. And, if we learn anything, new developments and things like that, we'll definitely pass that along. Thank you so much for joining us today, and we'll see you again next Tuesday on O2 Classroom. And thanks for joining us, and be well. Take care. Bye.